When you call your parents and you see that something is different about them, what is the first 5 steps when you notice parental decline?
Welcome to Senior Care Made Simple, an elder care podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
Good morning, good afternoon, good evening, everybody. I'm Andrea Albertini, host of Senior Care Made Simple podcast, and I am here once again with my favorite person, Doris Moscarella. Good morning, my love.
Hello there, everyone. Hello, Andrea.
How's everything with you?
Everything is great.
Well, you know, we are coming into season in South Florida, as you know. And for some of you who are following our podcast, we are located in Palm Beach. However, we're here to share wonderful resources and information to help anyone, any adults dealing with aging parents. Today, we're going to talk about top 5 first steps when you notice parental decline. And I know, Doris, you're dealing with your elderly mother. Would you like to share a little bit with the listeners some of the experience that you have had?
Well, as a matter of fact, I saw her this weekend. We got to get together, and wow, I saw so much decline in my mother that I adore. She is 94 years old, and she repeated herself like 10 times the same thing over and over. So, you know, these 5 steps that we're going to discuss are so important when we see this parental decline.
Actually, I was just talking to Rebecca, my administrator today, and she says people are living longer and they think they can stay home living longer. And by the time the children finds out, they're in a hospital. And we did an episode about denying when mom and dad deny care. What do you do when they deny care? And what's happened a lot of times is those patients are, those people are declining so fast. When they do decline, they decline very fast. They end up in a hospital. And then when it comes a time that I'm asking some of the people with aging parents, dealing with aging parents right now, when you call your parents, and you see that something is not right, they're repeating themselves, like Doris, like you said, yes, or they're a little confused, or, you see something is different. What should you do about that, right? We have a lot of people in Florida who the children don't live here. So then what do? You either fly over here, find out what's going on with mom and dad, or you hire a geriatric care manager or a home health agency such as Horizon Care Services.
One of the things is to start a gentle conversation, okay? For example, I asked her, how are you feeling lately? And she's always saying, I feel fine. But then you're going to have to observe and see what her reaction is. And you have to listen to what they think is changing. Try to get a conversation where they can tell you more. You have more experience than I do of assessing the safety at home of our grandparents, our mothers, our relatives.
Well, I had a client last week. A doctor called and said, hey, I'm really concerned about, the daughter is really concerned about her mom. Can you please give her a call? And so basically, she doesn't need around-the-clock care yet, but she's driving. She shouldn't be driving. But she needs mainly healthcare management, somebody to keep up with her doctor's appointment, somebody to be able to, make sure that she's taking the medication on time, make sure she's taking her medication, period.
Correct.
Make sure she's eating. So there's a whole process when you're talking about what's going on with mom and dad at home.
Absolutely. My mom, unless you feed her, she will not eat. And that's scary for me, because she could starve herself. And there's so many elderly people out there that don't have care and they starve themselves.
Well, we had another client. I just love to share those experiences with you guys because I know that a lot of younger people are listening to our podcast is the importance of when you think they're fine or they're telling you they're fine. So we had another client who actually was wheelchair bound and she had steps, right? But she didn't have any running water either. And she had an animal in the house.
Oh, wow.
So those are what we call the crisis, right? So we don't want any of you to be able to have to experience that with your loved ones. So that's why we're trying to bring to your attention, get in touch with your elderly parents or elderly grandparents or your uncles or aunts. See what's going on with them at home. There's so much that's going on that sometimes you don't even know. And we had to rescue that particular client of ours. We moved her into an assisted living facility and took the pet and board the pet, make sure the pet was okay, and had a company come in to be able to clean the place up and also make sure there was running water before we could bring the client back home. And that process took almost a month.
Why would you bring her back home?
Well, we brought her back home with a caregiver. So now she's
with
no
a
longer
caregiver.
alone.
Okay.
So now she has 24-hour services and she has us, our nurses managing her care to make sure that she's taking her medication, make sure the dogs are taken care of, make sure that there's never going to be a problem with running water.
Yeah, that's an issue.
And there's so much that goes on a daily basis. And, you got to remember, too, we had I think you and I were in this meeting in this country club the other day when they were very, very concerned about some of the people that are aging in place and they don't have any family.
Another thing that we have here out of the 5 steps is get a health evaluation, whether medical or cognitive. It's very important to encourage them to do this. Encourage a visit to their primary care, to review the medications, check on untreated conditions like hearing loss. Oh my God, sometimes I can't hear either. I'm suffering myself from hearing loss. Especially, my significant other, he says, "Can you hear me?" Now, sometimes it's, intentional.
You choose not to. You choose not to hear him.
I tune them out like our kids when they were growing up. But, our elderly people have now hearing impairment. Sometimes they have anemia, vision issues. So it's important they get a health evaluation, whether medical or cognitive, and screen for changes.
Yeah, and one of the things that I have seen a lot, believe it or not, is nutrition.
Oh, my goodness, yes.
And a lot of people don't understand nutrition. Actually, I was meeting with one of our concierge physician, and she basically said to me, she said exactly to me, she goes, being a concierge physician, I have a lot of elderly patients. And one of my biggest issues is nutrition. I said, one of the things that makes Horizon different, than other agencies, we provide a full service senior services. So we do have a full-time nutritionist that work with us.
That's great. I need one.
So I also feel that, many of the clients aren't just aging. There are medical issues that can be improved. And, a lot of people can live very long life at home with the appropriate care, right? You have a mobile physician come into your home. You have a pharmacy who deliver your meds. You have a nurse managing your medication management. And if you need companionship, if you need somebody that can drive you, remind you to take your medication. So the fact that their health, your loved one's health are declining, that doesn't mean that, it's the end of life. It's how can we provide the quality of life? How can you offer your parents, grandparents, or your elderly, relative the quality of life? Because we have clients here that with the right care, they have been in service with Horizon for 10, 12 years, 13 years. Your parents and your grandparents can live a very nice, comfortable life.
But you know what? Sure. If I can add to that, if it's okay to add to that, my experience, I went and you know how you go to CVS and you get the flu shot. So I decided to get the flu shot, the tetanus shot, and I got this cocktail of preventive vaccines. couple of days later, I started to run a fever. My throat started to close. I tried to get my primary physician an appointment. They said, well, next week, whatever the case may be. Let me tell you, I called Horizon Mobile Physicians. I said, no, I need to get treatment now. Within the hour, all right, number one, they contacted me. What are your symptoms? We're on our way. Start doing this. When they got there, they swabbed my throat. They immediately sent everything to the lab. They prescribed some medication, antibiotics, one for the swelling. I had an allergic reaction to the medication that I took. Within 2 hours, my medication was in my front door because they delivered it. So I'm like, okay, this is what I need. And I don't want to say I'm an elderly person. I'm a person that needs, something taken care of immediately. And I have to kudos 5-star to Horizon Mobile Physician for being there and taking care of me, because I don't know what would have happened if I didn't take care of it as fast as I did. My throat was closing up. So it was a reaction, an allergic reaction to the shot, my preventive shots that were going to kill me.
Oh my God.
I know, if you can believe that. So it's not only for elderly people, it's for everybody that needs medical assistant or health care. It's covering a broad, not only for elderly patients, as you were saying. So, I mean, we have people that are golfers and they break a leg or something and nobody takes care of them. You call mobile physician, they come and take care of you. They take x-rays, whatever you need. So, food for thought, not only for elderly people, for everybody. We talk about everything that we have the 5 essentials. One of the other ones that we need to talk about is begin gathering essential information. My cell phone, because everybody has a cell phone, I have my emergency contacts, medical list, doctors and specialists, insurance detail, and legal documents, because the phone is so handy that I have everything in there. I also have it for my significant other. The beginning of last year, he had a heart attack, and I had especially when you get nervous, you forget everything. I forgot his medications. I even forgot his last name when they asked me. So, talking about remembering everything, put it on your phone or put it on something that is easy accessible.
And I think also, too, one of the most important things that I think that children don't think about it is, have you spoke to your parents about, do you have a trust? Do you have a will? Do you have a healthcare surrogate? All of those things that needs to be put in place, right? And also, too, is exploring the support options that you have out there, such as home care agency, adult daycare program, transportation services, meal delivery, local senior center, care management solutions. We work with a lot of care managers around, and everybody specializes in something different. Some of them are, more to mental health. Some of them are more into guardianship. Some of them are geriatric care management. It's exploring the support that you need. There is help. There is support out there. But the most important thing is for you guys, for all of us actually, to be able to be very alert when it comes to, your parents, declining.
Absolutely. And early planning lets your parents stay independent longer and reduces stress for everyone, including yourself. So just to recap, the 5 steps when you notice your parents decline: start a gentle, honest conversation. How are you feeling? Number 2, assess safety at home. Very important. Medication routines, driving safely. Number 3, get a health evaluation. Medical, cognitive, very important. Number 4, begin gathering essential information, emergency contacts, medical list. Remember to put them on your phone. Number 5, explore support options early. There are a lot of them: home health care agencies, adult programs, transportation services, meal delivery, and much more. As we said, early planning lets your parents stay independent longer and reduces stress for everyone.
Thank you again for coming joining us today. our Senior Care Made Simple podcast. If anyone are interested in any topics, anything that you want us to talk about or bring it to you, please email us at seniorcaremadesimplepodcast@gmail.com. seniorcaremadesimplepodcast@gmail.com. I'm Andrea Albertini, your host, with your co-host, Doris Moscarella. Have a great day, everybody.
Senior Care Made Simple, an elder care podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.